Greetings. Let us learn about cytology brush. So here we are in the esophagus of an elderly gentleman who has been on steroids, prednisone, for his asthma, and he comes in with difficulty swallowing and retrosternal discomfort. What you observe on endoscopy is esophageal candida or candidiasis. And one could establish the diagnosis either by taking biopsies from those yellow plaques or by using a brush cytology. So let us learn about cytology brush. The handle has a thumb ring, and the slider will allow you to hold in between the forefinger and the middle finger. So let us learn about how to operate a cytology brush. When you take the brush out of the plastic envelope or paper envelope, it is usually in a closed position. When you put your finger in the thumb ring and hold the slider between the forefinger and the middle finger and close your grip, the cytology brush is enclosed in that plastic outer sheath. When you open your hand or open the right hand and push the slider forwards, the brush comes out. You could say brush open position. When you close your hand, the brush gets enclosed into this plastic outer sheath and it is in a closed position. After checking the brush operation, opening and closing a couple of times, make sure that you retract the brush into the plastic sheet into a closed position before you give it to the endoscopist. The endoscopist then inserts the brush catheter into the biopsy channel, and then when it comes out into the operating field, it is still in a closed position, and he will ask the assistant to open, and the brush will come out, and the endoscopist moves the brush catheter in and out of the channel so as to scrape that yellowish plaque material. And once he's happy with that brushing technique and obtained enough material, he will ask the assistant to close the brush. That will pull the brush back into the plastic sheet, and once it's in a closed position, the assistant takes it out of the biopsy channel. And once it's out of the biopsy channel, now the next step is to create a smear on a slide. So you open the brush and then take a slide or two and make a smear by moving it from one end to the other end. And this is how we prepare the slides with this cytology brush. And the slides are sent to the pathologist in a special container. Sometimes it may include a preservative for the slides. In addition, the brush tip is cut and the brush is deposited into a container with a preservative, and then this is also sent to the pathology lab. And the lab takes the brush and prepares the specimens for the pathologist. Cytology brush is used for obtaining material from the esophagus in patients with esophageal candida. It can also be used to diagnose cancer of the esophagus or cancer of the stomach by taking brush samples and sending the cytology specimens. You will learn that cytology brush can also be used in the bile duct to diagnose bile duct cancer. In terms of the adverse events of cytology brush is relatively safe, for the most part safe, with very few complications. I hope this is useful. Thank you.